Hello and welcome to Pixarize a Scene on Cori disease, also called type 3 glycogen storage disorder. In this image, we'll review everything you need to know about this disease, including its pathological cause and its clinical findings. I hope you put on some work clothes. We're going to be getting our hands dirty for this one. Since we are picturing a scene about Cori disease, it only follows that this scene takes place inside a rock quarry. Get it? Quarry for Cori? You know, those places where you get marble, granite, and other rocks. Check out this dark sign on the left with the arrow that points towards the Cori entrance. To help you remember that Cori disease is also known as glycogen storage disorder type 3, we've drawn this tree by the Cori entrance. This tree has strewn its branches everywhere, and it seems like management has hired a company in order to remove them. Next, take a look at this campsite made by our branch removers, where they've left a few sacks of sugar. Look familiar? Well, these should, because these sacks storing sugar are a recurring symbol for glycogen, which similarly stores sugar for later use by the body. These sacks of sugar are here to help you remember that Cori disease is a glycogen storage disorder. Afterwards, check out this small smart car driven by our branch removers. Small automobiles are Pixarize's recurring symbol for autosomal recessive inheritance. Just remember this small smart car in the quarry, and you'll never forget that Cori disease is inherited in an autosomal recessive pattern. Now let's focus on our branch removers, or should we call them debranchers? Notice how they've been pretty bad at doing their job. There's still branches everywhere in the quarry. The wheelbarrows they've been using to remove the tree branches are broken and are instead spilling branches everywhere. Cori disease is caused by a deficiency of debranching enzyme, less commonly called alpha-1,6-glucosidase. Debranching enzyme is important for glycogen breakdown because it usually works to remove glucose residues from Y-shaped points where glycogen forks or branches off. Another enzyme, glycogen phosphorylase, can only remove glucose residues in a straight line and not at branch points. In Cori disease, debranching enzyme is defective, which causes buildup of branch glycogen chains called limit dextrins inside the cytosol of cells. To remember the defect in debranching enzyme, just remember our defective debranching operation with its broken wheelbarrows and branches strewn everywhere. And to remember the buildup of branch glycogen chains called limit dextrins, remember that tree branches are also called tree limbs. Get it? Limbs for limit dextrins? Should get the job done. Next, look closely at the sugar stored by our debranchers inside the campsite. Some of it's stored away in sacks, but some of it is also available in its raw form as a sugar pile. We've drawn this here to help you remember that in Cori disease, gluconeogenesis remains intact despite the problems in glycogen breakdown. Unlike von Gierke disease, there is no lactic acidosis or severe hypoglycemia in Cori disease. As a result, the signs and symptoms of Cori disease are far more benign than those of von Gierke disease. So what are these clinical findings anyways? We've summarized them quickly in this image. First, take a look at this lever that opens the door to the Cori. See its liver-shaped handle? This liver lever is Pixarize's recurring symbol for hepatomegaly, which occurs due to accumulation of limit dextrins inside hepatocytes. Afterwards, check out this man working for the debranching company. Notice how he has stubbed his toe on one of the branches? No wonder why he's been so bad at removing branches. That big toe looks pretty bad. The painful big toe depicted here should remind you of the finding of gout, which commonly presents as acute pain of the big toe, also called podagra, in patients with Cori disease. Lastly, check out these 3 glass bottles of oil sitting on the tree stump in the debranching campsite. These 3 glass bottles of oil are a recurring symbol for hypertriglyceridemia or hypertriglyceridemia, which is found in patients with Cori disease. The symptoms of hepatomegaly, gout, and hypertriglyceridemia are caused indirectly by buildup of metabolites normally found in glycogenolysis. However, since gluconeogenesis remains intact in Cori disease, you should also know that these symptoms are far more mild than those seen in von Gierke disease. Therefore, we recommend that you instead focus on the unique finding of limit dextrins or branch glycogen groups inside of question stems. These findings would scream a defect in debranching enzyme or Cori disease on your exam. And that's all we have for Cori disease. Just remember the problems in tree branch removal to remember the defect in debranching enzyme. And recall our raw sugar piles to remember that gluconeogenesis remains intact in Cori disease. We'll see you next time.